Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing hydrocolloid wound dressing, so the benefits and the application. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So an overview of hydrocolloid dressings. So they were first introduced in the 1980s and they started becoming quickly used as a dressing. So they are composed of two layers. So an inner colloidal layer and an outer impermeable layer. So the hydrocolloid wound dressings are composed of a combination of gel forming substance. So in the presence of wound exudate, it actually like cross reacts and forms a gel substance over top of the wound. This provides a nice, just moist wound environment. Okay. So when they were first created, they were fully occlusive dressings, and now they tend to be semi-occlusive. So this makes them impermeable to bacteria and larger molecules, but permeable to water vapors. Okay, once again, to create the perfect environment for wound healing, because we want just that moist wound like our eyeball or any mucous membrane really inside of our mouth. We want a just moist environment. So benefits of hydrocolloid dressing. So this is a more modern type of dressing, unlike the original dressings like gauze dressings that just played an active role in wound care, or I should say a passive role in wound care. The hydrocolloid dressing is actually a more active wound dressing as it stimulates wound healing. Okay, so the benefits of hydrocolloids is that it provides a moist wound environment. Okay, so that gel that's formed over the wound, it creates the perfect environment for a wound to heal. We have decreased risk of infection, okay, because nothing can get in. Only vapors, water vapors can come out. Now, we also have to be careful with the water vapors, because if we have a wound that has extreme amounts of exudates, we still wouldn't use this. Even though we do have a good environment here, it's more of a moderate amount of exudate we would use this on. And with that said, autolytic debridement, because we have the fluid sitting there, just moistly sitting there, it does create an environment for autolytic debridement. Okay, and this is using the body's enzymatic system to get rid of any left necrotic tissue on top of that wound. Fit inaccessible locations, so hard to dress locations. These are great. They stick well to areas. I find this right in like the coccyx region. It works really, really well in that area because they can be hard to dress. And once again, it's also protecting tissue in case of any incontinence too. And then once again, protection of skin. So it does prevent it from friction and external trauma, okay? Friction shearing. So indications for use. So once again, it will form a gel over the wound, but it doesn't have great absorption capabilities. So we want to be using them on minimal to moderate amounts of exudate. So some of these wounds can include just abrasions, skin tissues, lacerations, and any wound with moderate to minimal amounts of exudate, pressure ulcers, dermal wounds, necrotic wounds, because once again, we'll have that autolytic debridement, partial full thickness wounds, surgical wounds, and then preventative dressings. So the sacrum, coccyx area, or heels, it's perfect for that. New hydrocolloids, you have to just keep an eye out for this, because some do have more absorption properties to them, and they can handle up to heavy amounts of exudate, but you have to watch out for the, just look at the packaging, because not all hydrocolloids can handle that, okay? It has to be specific ones, but there are some newer ones that can. So just some important considerations that you need to take with hydrocolloid dressings. So they do need to be changed about every 3 to 7 days. And now this is completely depending on how much exudate you have, so how much drainage you have. You need to be watching out for this, okay? We do not want macerated skin. Not all hydrocolloid dressing can be used on infected wounds, so you need to always watch out for product labels. Also hydrocolloids, they tend to create this malodor, okay? So as long as you don't have clinical signs and symptoms of infection, it is considered normal to have an odor when removing it, okay? It's almost like the gel, it creates an odor to the wound. Perfectly normal as long as you don't have the signs and symptoms of infection. Another one is fragile skin. We have to be super careful because this is an adhesive dressing. So in children and elderly, super, super cautious with these dressings because they do tend to pull. So I hope this video did help you and you have a better understanding of hydrocolloids. And I hope to see you guys in my next video. Bye, guys.